Thank you, Steve. Dr. Tain Tai, Deputy Health Ministers, distinguished participants, ladies and gentlemen, may I share the changing HIV epidemics in Indonesia. I will start by putting the Indonesian HIV epidemic in context. HIV epidemic in Indonesia is mostly at a concentrated level, except in Tanah Papua, where the epidemic is at low generalized level. The Indonesian epidemic is relatively younger in comparison to most epidemics in the Asian continent. Indonesia's sharp increase of new infections started in the early 2000s with the booming of the drug use, and along the time gradually became to be more driven by infections from sexual transmissions. In response, in 2006, the government of Indonesia enacted the presidential decree on the National AIDS Commission, which is a political commitment for the intensification of the AIDS response, which was followed by a series of enabling policies and program development. The integrated biobehavioral survey since 2007, and then 2009, 2011, and the last one in 2013 revealed that Indonesia is on path toward a turning point. We are seeing that different key populations are practicing safer behavior. We are also identifying that the HIV prevalence is declining among people who inject drugs and stabilizing among female sex workers, yet we are also still noticing an increase among transgender and men having sex with men, making the latter the current main drive to the growing new infections in Indonesia. Our 5 to 7 years of experience have brought us some lessons learned. We have learned that we need to put in place well-focused and clear policies, followed with improved programs and services for prevention and treatment. We also strengthen multi-sectoral response by engaging various government agencies, and most importantly, the strong, meaningful involvement of key populations, as well as a good partnership between international development partners and government, including civil society organizations. While Indonesia is still on the path to control its HIV epidemic, what would be the scenarios to get the next momentum towards the declining number of new infections among all key populations? Although preventive measures are now functioning, there are unfinished agenda. For instance, while program coverage is high, service quality has not reached adequate level yet. While not sharing needle among people who inject drugs is already relatively high, the condom use among them is still below the target. Consistent condom use among key populations tend to increase, yet the level of use among men having sex with men is still low. Although Indonesia is now low-middle income countries, that doesn't mean that we are richer straight away. We need to zoom in our approach to the individual level. Most of those infected and affected by HIV are from low-income classes, while the infrastructure of services and programs they are accessing are not adequate enough. Funding for the program, 40% already come from domestic resources, but 60% is still from external fund. ARV, in many ways, is already domestically supported, but preventive measures at community level at this moment is still dependent on external sources. Even more, we don't have a robust mechanism yet that enables the continual flowing of funds directly to community network to fulfill the needs for community-based program. So the challenges are at policy level as well as funding. We need to protect the current prevention program implemented at community level in the future, which are now still depend on international funding. Hence, it is imperative that international partners or donors must not abruptly exit a project, especially that for supporting civil society organizations and community network without a proper exit plan which considers sustainability. From here on, the way forward is that there are mechanisms that need to be established at country level, especially at local level. Local government have to have shared responsibility, especially toward community-based interventions. As you know that Indonesia is a very decentralized country that we practice this since 2001. Public-private partnership should grow at local level with shared local leadership. That local government work together with a civil society organization and also private sectors in that region. Greater meaningful involvement of community group is an integral element for sustainability. I thank you.
Thank you very much, Dr. Siregar. We're going to hear now from Dr. Sila Bapasiri.
Thank you. First of all, I would like to express my sincere thanks to the organizer and express my congratulations to Excellency Deputy Minister of Myanmar on your leadership on this great investment on HIV, prevention of HIV. I fully agree with the organizer and all the participants that this is the critical period for Southeast Asian country for make the momentum change. It's the time that we need to make something happen. Particularly, we are in the position that we are going to end AIDS epidemic. I would like to express and share some of the Thailand experience, and then we'll talk further on the effort or the collaboration, particularly with Myanmar, which is a very close neighbor country. We faced HIV epidemic nearly 30 years. In the early 90s, the explosive epidemic of HIV were controlled with the condom use program. However, this program cannot be possible with the effort of the government. It's the effort of all sectors, particularly the multi-sectoral, not only from health sector. In the year 2000, we expand the prevention mother-to-child transmission at the national scale within 1 year with the existing health infrastructure. In 2003, we expand the antiretroviral treatment using the generic drug and expand from 2,000 to now nearly 260,000 people in Thailand. In the year 2004, at the International AIDS Conference, the theme is Access for All. At that moment, we just launched the universal access to healthcare. Why antiretroviral treatment is still limited? It took us for 5 years before we fully integrated into the national program. Currently, Thailand is aimed for ending AIDS with the international community by 2030. We will expand and focusing on the HIV prevention to the most needed population to cover 90% coverage and expand antiretroviral treatment regardless of CD4 level to make the most use benefit of ART. But this cannot be done if we focusing only for Thai citizens. So our plan, our aim is for those who residing in Thailand, whatever or wherever their nationality. The ambitious and aspiration from this can make it happen if we have a good collaboration from all stakeholders. What we have learned from our past experience, I would like to say 3 key things. One is the leadership and commitment at all levels, from the policy commitment, from the policy leadership, along with the program manager, stakeholder, NGO, community. This is very critical and we have to sustain. Secondly, the effective intervention need to build upon our existing infrastructure. It's not the thing that we can import the innovation within our system without adjustment or without using the strong part of our healthcare system. So the critical point to make the success to scaling up the national program is the key to build upon our existing national system, not build upon the other knowledge, but we use the best knowledge of the new technology. And third, the trust from all stakeholders are quite important. So I think this is the key thing that make everything happen with that we can reverse epidemic. Actually, Myanmar is one of a good example that can reverse epidemic within limited resources. Thailand and Myanmar now are in the period of the future collaboration. We have minute of understanding to collaborate in 3 areas. One is on the capacity building of the healthcare system. This is the key thing that Thailand and Myanmar could do together and learn together. How can we strengthening and provide care to both to people of both nations? As Steve said, actually Thailand has allowed 3 million migrants, regular or irregular, living in Thailand. 75% of those are Myanmar migrants. Without the good supporting system, we are not able to achieve that. And they are not going just to live in Thailand. One day they will go back to Myanmar to help their own country. So this is something that why the healthcare system strengthening is one of the key areas of collaboration. Secondly is the community system strengthening. Thailand has vast experience in terms of civil society involvement, engagement, as well as the civil society, as well as the community strengthening. This can share and make it happen together. And lastly, since Myanmar is currently receiving the support to expand antiretroviral treatment to people, while Thailand also has the universal access, how can we harmonize the treatment system within 2 countries so we are able to make the most use benefit of this, the resource that we are going to use. This period of the this period is a big challenge for both countries, not only to scaling up services for those who are needed, but the most important, how can we sustain with our wisdom, with our limited resource, and sustain that for a long time. So that need a support and understanding from all stakeholders. I thank you.
Thank you very much. We're next going to hear from Emin Murphy, Director of the UNAIDS office in Myanmar. Emin.
Thanks very much, and it's a great privilege to be speaking on the panel. I think the theme of great change in Southeast Asia is, as the Deputy Minister said, extremely strong in reflection in great change in Myanmar itself. She talked about a triple transition towards peace, democracy and an open economy. And it's a country that is going through rapid transition, and with that brings great opportunity for the health system, but also brings additional burdens and challenges for HIV and for the health system itself. The ministry firstly, the President Thein Sein, has made a major commitment to health reform, and that is clearly reflected in the work that the ministry is going through to identify how to keep doing what's doing well and what to change. And recently there's been opportunities of looking at areas of the country that have been closed off to access to health services by the government. There's been missions to the Wa state, and there are other parts of the country that the ministry is working with the local authorities and the ethnic groups, as the Deputy Minister was referring to expand services. And that's a great opportunity, but with that comes an even greater challenge for the system, which has some capacity constraints. And the Deputy Minister talked to those quite clearly in her presentation. 8.5% expected growth in the economy in the next 2 years is another great opportunity. But we also see in countries in transition and rapid transition that there's risks involved with this. Greater inequality, inequity can occur, poor at risk of being left behind. And these are also risk issues for HIV, because we know how the virus is quite opportunistic and discriminatory, I think we've heard in the theme of this conference. And so people who are marginalised or poor often have a greater impact. We will see greater internal migration, and we just heard from our colleagues from Thailand about the cross-border migration. There'll be increasing internal migration. Dawei and areas of the country that are industrializing will draw people from rural areas. There's increased drug production, which is a major challenge for HIV, given the remote areas of the country where a lot of this occurs, and the challenges to provide services in these remote areas. Potential for increased sex work because of the commercialization, the industrialization, and the movement of people. The Deputy Minister talked about health and development infrastructure being weak. And I recall in 2002, there was a period of thought of change, and there were discussions going on at that time. The change now is real, and that's a significant difference. But I recall Aung San Suu Kyi talking about, regardless of which government will be in power, it's the same doctors, it's the same nurses, it's the same police who will be there. And unfortunately, one of the mistakes, I think, with the nature of the sanctions that were applied and were referred to in the Deputy Minister's presentation, is that was a double punishment, because the opportunity for healthcare workers to continue access to information and opportunity for study outside the country was a major deficit. And I recall in 2002 there were 4 or 5 people in the National AIDS Program who had postgraduate studies from outside the country. Now the Deputy Minister's working with many partners to try and give opportunity to healthcare workers to again have this opportunity to learn from other countries and how they're doing it, because National AIDS Program doesn't have that many people now with postgraduate, and so they're trying to rebuild that capacity, and that can't be done in a short time. And so that puts additional constraints of sending skilled people out of the country to further their expertise at the same time of expanding coverage and services in the country. So these are some of the challenges, but Myanmar and the people of Myanmar won't be held captive to the history and the past, and are very pragmatic and looking forward for change. And that's one of the strengths for health reform that we're seeing. The Deputy Minister talked about resources, and there's a need, well actually there's a need for more resources from some governments, I think both technical and financial, and I think the US might be one that could do a bit more. But we have the Global Fund who's returned. But again, we had a gap of period where the Global Fund was active and then closed down. And that puts a double punishment on the people and on the systems, and that's what the government today is trying to redress. The 3MDG that was referred to is a major partner that starting to work with a changed environment, the financial landscape, the management landscape, the sense of national ownership is emerging, and yet some of the donors are behind the ball in this. We need to see more usage of government systems. Deputy Minister knows well health system strengthening is not easy to change a system that's not been absorbing lots of resources, and so it's not saying all the money has to be funneled through the government system immediately, but we need to start putting that grease on the wheels and getting those systems operating both at the central level, the national, the state and regional and the local level. And so we need to move from, I think it was parallel financing you mentioned, Deputy Minister, to using and putting part of these resources through the government systems as a way of strengthening the systems. And so I think that's an important thing. The Global Fund is looking at transition of the principal recipient responsibility to government, and so that will happen in the next couple of years. So these are great areas of change and normalisation of how the system should work. Coordination was touched on, and that's really important because we are getting new partners. It's not quite Cambodia, where we saw an influx of many people competing for the same space, but we are seeing technical partners arriving and not knowing the landscape and who's doing what, and suddenly offering the same services and the same assistance that others are already providing. And so this is going to be a challenge for the health system, is that coordination, and our role is to try and support that. UNAIDS provides secretariat support currently in partnership with International Health Division of the Ministry for the Health Sector Coordinating Committee, which was the CCM, which many countries and colleagues are familiar with elsewhere. But the Minister decided to broaden it for all of health, so he didn't end up with multiple parallel coordination mechanisms. He wanted to bring that together. So that's an important change, but that coordination is going to be vital to make sure that we don't end up with duplication and waste of the limited resources that are there. Information and understanding is another critical area of the health sector, which is also for HIV. Knowing what is the nature of the epidemic in geographic areas at the subnational level is going to be vital. Kachin State is so different to areas of the south of the country, and the nature of the response in the health system and for HIV are very different. So building the capacity to understand the nature of the epidemic and the health situation in an area, and then the type of response that's needed, is going to be vital. So there's a lot of investment and support in this area. Civil society, strangely many people assume civil society had very limited space, but civil society is quite active and quite strong in the health sector, even though the Deputy Minister has indicated to increase that even further, particularly at the local level. Myanmar's recently enacted a law on association. It's a registration law for civil society. And I've seen reviews by international groups that saying it's one of the best in Asia and the Pacific. But an interesting critical role there was that the civil society groups that grew up through the HIV response and have been supported and part of the participating in the system were crucial partners with the new parliament, which is another new area for Myanmar, is the role of parliament, to develop this law. And so they could apply their knowledge of the community systems in this law that has just been developed and passed by the parliament. Civil society still needs strengthening, as the Deputy Minister said, and so it's not just the health system, it's the role of the partnership with the community, with the local organisations, the national NGOs, rather than a dependence on international NGOs. And some of the international NGOs are changing their nature of their program. I know the Union and a number of others who are working in partnership within the government health system to strengthen and support the government's agenda to rebuild a strong health system, as they are in education and other social sectors which were neglected in the past. Dr. Teresa talked about needing to look at innovation. Myanmar's always had an agenda with this, with the limited resources. And I think you were very right, Doctor. It's amazing how much success has been achieved with limited resources, yet we know sadly quite a lot of people in HIV died because of lack of access to treatment, and that's rapidly being addressed, and the scale up is more than 50% of those who need it in a very short space of time have been provided with access to treatment. But looking at different ways of doing things, access to rapid testing, community-based testing is a major agenda. And in some countries in our region don't have rapid testing at all, let alone community-based rapid testing. And so the goals that Myanmar has set are ambitious, but the energy and the commitment and the resources are being applied both by government and by other partners to try and address that. Yet we have other areas, hidden MSM. Civil society will be talking at this conference about how to reach those populations who are affected by the barriers of discrimination and stigma. Sex workers, partners of the key populations. The other area of change is the new domestic partnership. I mentioned the Parliament, and we have a number of parliamentarians who have come to this meeting, as they did to the ICAP in Bangkok, to see how others are doing and look at what they're doing. They're looking at their own law reform. Many pieces of legislation are being addressed, but there are a number of critical areas of old colonial law that needs to be changed, which are barriers to successful implementation of health, and HIV in particular. So we won't go through those now, we don't have time for that. But there are also new partners re-emerging. A partnership with the Ministry of Home Affairs, and that's both the policing area, but it's also General Administration Department. These are re-emerging to support, because it's a multi-sectoral response the Deputy Minister was referring to, and these ministries need to see what is their role to be supportive and provide that enabling environment for health to respond to the issues. And we do know there are differences in different parts of the country, and there's a major problem in Kachin right now with the community understandings. Justice Kirby talked about it's not just laws, but it's that community understanding of why we need change. And I know in that particular area, the community doesn't understand the need for harm reduction well enough, and is creating the barriers and putting pressure on government not to put in place the services that government has for people who inject drugs. And so that's an issue that we need to collectively in partnership address. And issues there with rights to health and other human rights. Sustainability is the other major issue, because we're not going to see the big windfall of donor resources that some other countries benefited from because of the point of history we're in, and we don't have that around. So this is why the health reform is so critical, because the new agenda that's being set is how to use the resources that are growing domestically, plus those available international support in the most effective way to have the greatest impact. So we are seeing a lot of positive change with that. The Deputy Minister finally talked about integration. HIV needs to integrate, and looking at universal health coverage. What's the place of HIV in that? Mainstreaming prevention of mother-to-child transmission is already occurring and needs to be scaled up. These are critical areas that we can strengthen and integrate HIV so it's not seen in isolation. And it's a great opportunity, this reform agenda, to make sure this actually does occur. So I think I might leave it there, because it'll be more interesting to hear from the audience questions.
Thank you. Thank you very much, Eamon. We're going to hear now from David Wilson from the World Bank. David.
Thanks very much, Stephen. I've been asked to talk about two things: the World Bank's health engagement in Myanmar, and about a recent regional report that we have drafted and are consulting on this afternoon. The World Bank's overarching goal in Myanmar is to assist the country to sustain and intensify its current 6.5% growth rate, and to assist it to ensure that that growth rate contributes to reduced poverty and to reduced inequality. And to that end, as Stephen said, our President Jim Kim pledged $2 billion towards Myanmar and $200 million in an initial health contribution. The focus of the health contribution is to strengthen primary health care, and in particular maternal and child health services in the first instance, leading towards stronger health systems in the second instance, and universal health coverage in the third instance. And our health program focuses in particular on the strengthening of decentralized services and on increasing autonomy for decision-making and resource allocation at the decentralized level, because we think these can contribute to immense health gains. And to that end, our principal financing mechanism, through which 92% of our resources will flow, will be results-based financing, which has an excellent global track record in increasing health service performance, but also increasing autonomy for local decision-making and resource allocation. We'll also be focusing on strengthening data for decision-making. HIV is a good example of using data for good decision-making that we can extend to the wider health sector. And we're also working with the government to create transparent mechanisms for resources to flow to the local level and to be allocated for best health outcomes. With respect to HIV, we very much agree with Eamon that the time to integrate is now. We need to plan now for an integration that will take many years, but which needs to begin urgently. And I can't underscore enough the importance of planning for the integration of HIV treatment, HIV care, and HIV prevention services into UHC. And I would just point out that Thailand offers an excellent example of how this can be done. It also offers me an opportunity to bridge into my final 3 brief observations. This afternoon we'll be sharing the draft findings of a financing piece in partnership with UNAIDS. And there are 3 messages. The good news is that we can substantially reduce HIV and AIDS in Asia for a relatively small part of our overall health spending, as Thailand has shown. So that's the good news. We can substantially reduce it for relatively small parts of our health spending. The very good news is we can have even greater impact for the same money if we target our investments to the top priority interventions, geographic areas, and populations. And the sobering news is that Asia must finance an increasing share of its AIDS response from domestic resources. And international resources will increasingly focus on the highest burden, lowest income countries. Obviously, Myanmar has a longer transition than many countries in the region. But the bottom line is the time to begin integrating services into our UHC planning is now, and the time to begin planning for integrating HIV into domestic financing is now, as Thailand has done, even though the horizon may be longer term. Thank you.